Welcome to Save With CPR's Infant CPR, AED, and Choking Relief training video. In this video, we will cover infant chest compressions, infant rescue breathing, use of an AED for an infant team CPR, infant choking, and we will review. Chest compressions in an infant can be done with 2 thumbs or 2 fingers depending on your need to move the infant. If the infant is on a hard flat surface and does not need to be moved, wrap both of your hands around the chest of the infant with your thumbs resting on the lower half of their breastbone. At the same time, press both of your thumbs into the infant's chest about 1/3 the depth of their chest at a rate of 100 to 120 compressions a minute, fully releasing pressure between compressions. If you need to move the infant, rest them on your arm, supporting their head in the palm of your hand. With your other hand, place your index and middle finger over the lower half of their breastbone, compressing their chest about 1/3 the depth of their chest at a rate of 100 to 120 compressions a minute, fully releasing pressure between compressions. One of the main reasons children and infants go into cardiac arrest is respiratory failure. That is to say, rescue breathing in children and infants is extremely important. This rescue breathing allows you to replace depleted oxygen in the victim's blood. Two options of rescue breathing are mouth to mouth or mouth to mask and bag valve mask. With either technique, you will want to provide 2 breaths, stopping once you notice chest rise for every 30 chest compressions. If you're acting as a single rescuer, you should perform a compression to ventilation or CV ratio of 30:2. That means after 30 chest compressions, you should perform 2 rescue breaths. However, children and infants have a higher baseline demand for oxygen, and low oxygen is a leading cause of pediatric cardiac arrest. That means if you have multiple rescuers and can effectively do so, you should utilize a CV ratio of 15:2. That means if you have multiple rescuers, you should deliver 2 breaths after every 15 chest compressions. In infant mouth to mouth or mouth to mask, place your mouth over the infant's mouth and nose, forming a seal, or place the mask over their face, forming that same seal. Tilt their head slightly back without going too far. Exhale while watching for and stopping when you notice chest rise. Allow the infant to exhale and deliver 1 more breath while watching and stopping for chest rise. To use a bag valve mask or BVM on an infant, place the infant BVM mask over the nose and mouth to form a seal without excessive pressure, which could compress the infant's airways. Tilt their head slightly back without going too far. You may consider placing some padding under the infant's shoulders instead. Deliver 1 breath over 1 second, stopping when you note chest rise. Then release the bag over 1 second, allowing the infant to exhale. Deliver 1 more breath over 1 second, stopping when you note chest rise. AEDs are to be implemented immediately upon availability during your chest compressions and rescue breaths. The person delivering the AED should be directed to work around the chest compressor to deploy the AED. Most AEDs have separate pads or modes for children and infants to deliver a lower energy. If present and able, use the child pads or child AED mode. If unavailable, you may use adult pads or the adult mode on a child or infant. As pictured, to operate an AED, follow these 3 simple steps. Turn the AED on, place the pads on the victim, and follow the AED prompts. Make sure to avoid touching the patient while the AED is analyzing and during shock delivery. For an infant, place 1 pad on the center of their chest over the breastbone, with the other pad placed on the center of their back opposite of the first pad. Make sure to avoid overlapping the pads. If you have multiple rescuers, one person should establish themselves as a team coach. The role of the team coach is to ensure all important steps are being taken effectively and to promote effective communication. An effective team coach will do the following. They'll identify and designate a person to activate 911 and ensure responders have access to the area. They'll also identify and designate a person to perform chest compressions and switch them every 2 minutes or sooner if they get tired. They'll also provide encouragement and coaching to the chest compressor if and when necessary. And finally, they'll identify and designate a person to retrieve the closest AED and deploy it. All of the steps of CPR need to be performed, and having a team with a team coach allows a resuscitation to happen quicker and with greater efficiency. Infants may choke for any number of reasons. It's important to quickly identify a choking infant and respond appropriately. A choking infant may or may not appear in distress. You may not hear breathing sounds or crying in an infant that is choking. You may notice their skin changing to a blue color, especially around the lips and fingernails. We'll talk about choking relief soon, but if choking relief fails and the infant becomes unresponsive, you need to start CPR. To rescue a choking infant, you should place your arm along their chest, supporting their head without blocking the airway. Tilt the infant downwards and slap their back between their shoulder blades 5 times using a forceful and brisk movement. Then roll the infant, supporting their body with your arm and tilting their head downward to provide 5 chest compressions. You will repeat this process until the object becomes clear. If the infant becomes unresponsive, you should start CPR immediately, and don't forget to call 911 when possible. Pause the video to take a few moments to review the questions on the screen. Next, we will be reviewing the Infant CPR AED assessment tool used to complete your training. In order to be issued a certificate of completion for infant CPR, AED, and choking relief, you must be able to perform all of the steps required to perform infant CPR and AED. Using this tool, you may either perform a solo rescue with just yourself, or you may work as a part of a team. If you're working as part of a team, you'll have to do multiple rounds where every team member performs every single task. You'll be given a scenario with an infant that's unresponsive. You'll first have to perform initial scene management where you check for breathing and responsiveness, but for no more than 10 seconds. You'll then have to call for help, directing somebody to call 911 and get an AED. You'll be informed that the victim is not breathing, not responding, and they are pulseless. You'll need to initiate immediate CPR, performing high quality chest compressions, utilizing proper finger placement, proper depth, allowing for chest recoil, and implementing the right rate and rhythm. If you're by yourself, you'll have to perform 2 rescue breaths after 30 chest compressions, without delaying compressions for more than 10 seconds, ensuring chest rise with each breath and stopping on chest rise. If you have multiple rescuers, you'll utilize a 15:2 CV ratio. After delivering your rescue breath, you must immediately resume chest compressions. Whenever an AED becomes available, you'll have to deploy an AED while continuous high quality chest compressions happen. You'll need to turn the AED on, place the pads on the victim, follow the AED prompts, safely deliver a shock if required, and immediately resume high quality CPR.